This is a People First Radio podcast.
A Victoria-based company aims to take the inpatient addiction treatment experience and deliver it online. I spoke with Home-Based Recovery Executive Director Rob DeClark about what that looks like.
My name is Rob DeClark. I'm the Executive Director with Home-Based Recovery.
And how exactly does home-based recovery work?
Yeah, I think the background's important to discuss in terms of how we landed in the place of wanting to, develop and roll out home-based recovery. I have spent most of my career sort of developing, managing, and starting inpatient, addiction and mental health facilities. And, 25 years of sort of working in that environment, the landscape changed considerably in terms of the amount of options and also in terms of the cost of treatment. Treatment started when I was in the field at somewhere around $15,000 to $17,000 for a 6-week stay, and now your average is going to be north of $40,000, $50,000 plus $1,000 to access the same level of care, and in that there are certainly people that require inpatient treatment, and we can talk about that a little bit later. But through the sort of process of developing and managing those centers, there's a core curriculum that is delivered. It's a set of psychoeducational videos. It's individualized treatment through therapy. It's a balance of exercise, nutrition, and there's a core curriculum that we're looking to develop and we're looking to deliver. We took that learning and that experience and thought, how do we reach more people? How do we access more people that are in need? There is no lack of need when it comes to sort of people needing addiction recovery. And so we took that core curriculum and we put it into a learning platform that basically delivers that to people, from their home. So they can sign on. They would do some of that work themselves. So they would watch a meditation video, they would watch psychoeducational videos, answer questions, and do homework on how those videos apply to their lives. And those videos are really looking at what is addiction, how is it developed, understanding that we have it, and then also the skills and techniques and tools required to make the changes that are necessary in order to maintain long-term sobriety and sort of find a quality of life that is improved from the one when they started. And so the way it works is there's a 30-day program, and then we attach an individual therapist to each client. And so the individual therapist will spend up to 20 hours with that person, and that is where we can really individualize care, right? Really tweak the plan, make sure that we're delivering the best plan for that client. Lots of people in inpatient facilities, over my experience over all those years, they wanted more individual therapy. They wanted more time. And so that's how the program works. It's the same core curriculum that you would get if you went into an inpatient facility. You do it from home, and you are guided through the process with some intensive hours of individual work. The individual work is certainly guided by answering the questions, it's sort of guided by the program, and then there's the open-ended therapy that we do, right, sort of as well. After they're done the 30 days, there's a 6-month aftercare program that people join. So they join a group, 90 minutes a week, relapse prevention techniques, ongoing support. So the whole program itself is actually a 7-month experience. And so we've had some good success in treating the appropriate client with the service.
So basically what I'm getting is the spine of this is a 30-day curriculum. It's like an online course that's delivering the same material you would get in recovery, paired with you're going to have a one-on-one therapist for like 20 hours over the course of that month, also online. Is that a correct understanding?
Yeah, that's a correct understanding. So, some of the barriers that we remove with that model, obviously financial is a barrier for people. Our program, the whole 7-month experience is going to be around $7,700 compared to the numbers that I gave you earlier. We have less intensive models where people do 6 hours of therapy for 3,500, but the financial burden is considerably less. The other barriers that we remove is people that don't they can't access treatment, maybe because they have kids, because they have a job, because they don't want to, if they left their job they might lose their job. They don't want to leave their life in order to access help, right? One of the cohorts we see a lot of is mothers who don't have the ability to just leave, right? They still have to sort of maintain the responsibilities of childcare, and there's a lot of barriers why people can't access the level of care right of an inpatient center. So it's sort of for there'll always be people that need inpatient. You might need medical supervised detox. You don't have a safe place to do the work in. You can't get sober unless you are removed from your environment, right? You can't break that pattern. But we certainly sort of see that we fit in the continuum of care somewhere between weekly counseling, which might not be enough, and the full 6 to 8 weeks of leaving and going out to an inpatient facility. We're sort of in the middle, and so how we can assist people who need more than individual therapy, but for whatever reason can't access inpatient care.
You suggested there that there's an idea in addiction that you have a really hard time getting out of it unless you are able to get yourself out of the environment that is maybe causing you to use. How do you approach that hurdle with an online course?
So that's some of the first thing we do is a really thorough assessment with people, and we choose our clients wisely. So there's no point in putting people through a program that has a very, very low chance of success, right? So if we know that somebody does not have supportive family members, does not have a supportive group around them, doesn't have a safe place. In other words, people might be using in the house that they're living in, or right, that there are certain steps we need to take to set up success. And so sometimes we will have people access medically supervised detox through one of our sort of local detox centers, and ensure that we have housing and some of the basic safe needs met. The other answer that I'll give to that question is there can be two sides to that question. So one is I need to remove myself from the environment to get clean, but what ends up happening is I go off to an environment that is not it is not my regular world, right? And so people go off into treatment, and from my experience, the hardest time for somebody leaving treatment is that first 72 hours as they try to take all the skills that they learned in this other world, and all at the same time they go home and find themselves right within a couple of hours they're back in their regular environment, and they're trying to incorporate recovery into their home. And what we do a very good job of is incorporating recovery into their home live. Right. So still have family responsibilities, still have work responsibilities, still have financial stress, still have relationship stress. And then you have a session that night to talk about it, right? To work through and incorporate the skills as you're learning them, and incorporate the skills live on the spot, which has its benefit, right, to doing it that way. As long as you said, you can make the break and make the change into the first stage of recovery, which is to stop using. As long as you can do that from your home environment safely.
What would you point to as far as the efficacy of what you're doing, and what kind of data are you tracking for people who go through the program?
Yeah, that's an excellent question. And there's anybody who gives you a quick answer to that question, I would wonder if it's accurate. So, this will be a bit of a long-winded answer, but I think it needs to be in order to put context to it. So, all data that's collected is self-reported from the client without medical verification. So medical verification would be either urine tests or you're, physically seen signing into meetings or something, right? Like, the clients self-report to us how they're doing, right? And if you were to take that and, sort of run it through, certain standards, you might question if you're always getting an honest answer there, and sort of how valid that data is, right? So that's the first part. It's all self-report. The second, sort of part of the conversation is, how do you determine success, right? So do you determine success by completing the program? Do you determine success by complete abstinence? In other words, no slips, no drinks, nothing at all. Do you determine success by quality of life, right? That you have not only made the change in terms of your substance use, but is your life better, right? And I would argue that the answer is a combination of all three, and sometimes can be a bit individualized in terms of sort of how people are, what exactly their goals are. So we know that the vast majority of people in the neighborhood of much larger, in the neighborhood of about 82%, 80 to 82% of our clients are sober through the 7 months. So they finish the 30-day program, they do the 6 months of aftercare, they stay attached with us, and they report to us that they have been sober, throughout that period. We have had another section of clients that would have had a slip of some form. So maybe over 7 months, they used on 1 or 2 days. I would argue that's success. There are those that wouldn't, right? The older school kind of AA 12-step model would be to count your days, and once you relapse, you start again, right? And there's validity to that in terms of if somebody is continually every 30 days using, or there's some pattern that's not working for their life and they're sort of staying stuck in these periodic relapses. But if somebody, has a slip one weekend and gets right back on track and continues with recovery and maintains recovery after that, I'd argue that that's okay, that's still a success, right? And then the challenging part, and the part that we are just undertaking, is to take a long-term quality of life study with our alumni, with their former clients. And we're just starting that process now, and hope to be able to deliver answers to all three. How many days have you been sober since you started the program, or how many days have you not? And then, is your life better? Because I would certainly argue that if your life is not better, there could be mental health concerns that haven't been addressed. There could be other subsequent work that we need to do. There could be, sort of multiple reasons for that. But ultimately, the goal is to actually improve quality of life, not just stop using. So the other thing I'll say, those numbers are really high. Okay. So you even say that we have 82% of people that are still sober at 7 months. So there's a reason for that. And that is what we talked about earlier in terms of we choose our clients wisely. So there's this idea that you have to lose everything before you can get into recovery. It's this old myth that you have to hit rock bottom. And rock bottom is often described by people as, I've lost my job, my house, my family, I've lost everything, right? I am homeless, and, I've hit sort of the skids, so to speak. One of our goals, one of our mandates as an organization, is to raise rock bottom and have less people experience the full, sort of losing of everything that I just described. And so we would, if you were to take, and this is, often, addiction physicians, when they do assessments, would say people are in early, mid, or late stage addiction. Our clients are primarily in early and mid stage. Most are still employed. 90+% are still employed. 90+% still have a home and a family, and they're still engaged with all those supports. They have a high, what we would call recovery capital, right? And so that client is probably inherently has the people around them, has the culture around them, has the support around them, has the ability to do better, sort of by and large. So I'd like to say we are so awesome that that's the sole reason why our numbers are so high. But it's a combination of who we choose to treat and who enters into our program, the integration of the skills live that we talked about. So those numbers are high, but there's some reasons for that.
You're listening to People First Radio. I'm Joe Pugh. My guest is Rob DeClark, Executive Director of Victoria Company Home-Based Recovery, a private addiction treatment provider that aims to take the core elements of an inpatient treatment experience and deliver them as an online course. We're speaking about that and a few other issues in the world of addiction treatment. A number of people from kind of all across different sectors related to addiction recovery have used the phrase that relapse is a part of recovery. Statistically, it's almost, it occurs at a very high proportion. And there's also the idea that if someone enters recovery and they stop using for a prolonged period of time and they do experience a relapse, they're extra vulnerable to experiencing severe consequences from an overdose. I'm wondering how you approach that idea as a recovery, as a treatment provider.
The substance that is primarily being referred to when it comes to the data that tells us that people are at high risk for overdose is largely opiate use disorder. So we're talking about fentanyl, heroin, in the opiate family. There's a couple, so best practice, and we know all the evidence in the world tells us to get people on Suboxone or Sublocade as an opiate assisted therapy. And so there's a couple different ways that we will work with people to do that. So we do in that assessment phase that I probably haven't spoken enough about is we will, if there is an opiate use disorder present, we will assist people in accessing their local, sort of RAC clinic or physician. We do have medical professionals that we contract with that, if in the right area, could see people and assist them on getting on Sublocade or on Suboxone, which mitigates the risk of overdose considerably. And so we will certainly ensure that the beginning stages of recovery are done safely. Alcohol withdrawal, another one that requires medical intervention. So if somebody is saying, I've been drinking daily for years, we would likely recommend that they go and get and are medically supervised through their detox. So we'll assist them in finding a local detox center. Sometimes we will work with some of the centers for a 10 or 14-day stabilization stay before they start our program. So that is a clear criteria that we need to meet responsibly, right? That we need to make sure that we are having people go through that initial phase of withdrawal management in a responsible fashion. The conversation that is had around attempts at recovery make it more likely for overdose. Those are very valid conversations and very complex conversations. So the alternative sometimes is that, we leave people where they are, right? And if somebody is saying, I want to stop using, so that's an important, right? I want to make a change. They're reaching out to us, right? We don't comb the streets for people. They're reaching out to us, and I want to make a change. There are ways to do that safely, and I think that attempt at recovery is worth it, right? I will I won't talk about myself and my own story too much, but I am in a few weeks 28 years sober from opiate use disorder, and I had multiple attempts at recovery. I had three significant ones of inpatient stays, and the third one stuck. But when I reached out and asked for help and wanted help, I was able to access it, and there wasn't Suboxone or Sublocade; those drugs weren't around then. But to I'm glad nobody said, you're probably stuck there, right? There's no way out. The risk is too great. And I did have, multiple overdoses, and I did have, sort of those experiences. And so it's a valid conversation. It absolutely is one that needs to be, like I said, we need to manage that conversation. We need to manage that individual case responsibly. But I'd also argue that the attempt at recovery can really change lives and can really change and give people that hope that, you don't need to have 50K to get out of right where you're at. I mean, we can manage and, sort of connect you with appropriate resources that do exist. And this is just another pathway into recovery for folks.
When it comes to the cost of various forms of addiction treatment, you've talked about how inpatient treatment can range from $30,000, $40,000, $50,000, depending on where you're going, depending on how long you're staying. The program you're offering, you've talked about a cost just north of $7,000. What kind of supports are available, if any, for people to get assistance with some or all of those costs?
So we can mitigate the costs. So our sessions are done by registered therapists, and if you have a benefit package, you can claim those, and you can claim them up to your maximum, whatever your sort of benefit package would. Right. That's the only formal funding sort of assistance that we can currently offer. We would love to have the conversation with, sort of with local government, with local health authorities about providing, assistance to people and sort of accessing funding. If people do not have sort of the resources for our program, or they don't have benefits, or there is this conversation is evolving quickly. There are more certainly I would say go to your local hospital, go to your local health authority, and look up the phone number that's associated with addiction and mental health care in your community. And there are very hardworking people there who are trying to serve as many people as possible. There's often a bit of a wait, because of the need. There are pathways into recovery through the public system. There isn't a lot of, there are some beds, not a lot of beds in BC. On Vancouver Island, you could probably access 25 to 30 beds that are available for inpatient stays through publicly funded sources. And as you can imagine, there's far greater need than that. I do believe this conversation is evolving and changing, and I think as the sort of, unfortunately, the political will has increased to do something about the drug crisis in this province, I think you will see those numbers increase. There are, I think that there are ways in which that organizations like ourselves can provide some of those services, right? We have the expertise, we have the resources, we have the therapists, we have the people. It's a matter of figuring out the partnership with local governments.
A number of people occasionally talk about the idea that accessing, as you mentioned, accessing addiction treatment support through the public sphere, there isn't nearly enough supply to meet the demand out there, and then it can kind of be like a wild west on the private side of treatment. What would you say about that idea and that situation as far as people looking to navigate that world?
Yeah, there are, I mean, facilities need to be and are licensed in BC. Excuse me. So, the Vancouver Island Health Authority licenses inpatient facilities, and I believe some of that regulation and oversight will and should extend itself to programs like ours. Right now, there isn't a place for us to go get licensed. So I think that the when it comes to the sort of wild west of private care, there is nothing necessarily stopping somebody from just opening a center either, right, or opening up a facility. And I think the largely it's when you're paying those top dollars, what I would say to people is understand what you're paying for, right? So in some of those facilities, you're paying for Red Seal chefs and ocean views and private rooms and king size beds, and you're paying for a lot of amenities. And I would argue that look at the staff page, right? Who are the people delivering the service? And do you have master's level therapists and addiction physicians and psychiatrists and psychologists? And who is, that to me is far more important. And I get a lot of calls, both personally and professionally, from people that say, I have a client, they need inpatient care. Where do you recommend they go? And it's a different answer for different people. Some people do really well with concurrent mental health and addiction disorders. Some people are, some centers are much more focused on simply treating addiction. And so it's a very individual answer in terms of what might fit for the right person, but find out that what their specialty are. And that to me is the people. Our industry is 100% about people. We are people talking to people, right? We are people delivering care to people. And so there has to be a large degree of care and attention. You have to have a staff that is, a high staff to client ratio. You have to have those qualified staff, absolutely, that are licensed professionals, that are held to standards that licensed professionals are held to. I think there's how much comfort do you want to pay for, right? How much amenities do you need through this process? And, what's important to you, right? What do you value? And, so what's important to the experience that you want to have? If you want your own private room, you're going to pay for it, right? You're going to pay a higher rate than if you want a shared room. And so those are individual decisions that people, need to make based off what they're looking for. But certainly I would say check the staff page out.
I've got to let you go in just a minute here. Is there anything else you think it's important to let people know about the work you're doing and home-based recovery?
Yeah, I just would, first off, like to really thank you for reaching out and having this conversation. I think, the more we can find different pathways. This isn't about one thing's better than the other, one thing's right and one thing's wrong. And, the debate that happens around harm reduction versus abstinence and all of the, let people find the path that works for them. And what I would, highlight is this is a different path that hasn't existed previously, right? So this is a virtual outpatient program that allows you to not have to leave your house and your family and your responsibilities, allows you to access care, quality care with highly, sort of trained professionals and a lot of experience, in addiction care. There are other paths. There are other paths into recovery, and I don't think we should want to shut down or close off any of them. I think the more paths that we can create, the better. And we're excited about this one. We think it's new. We think it is needed. We think it's a bit of a sort of middle ground of people that sort of previously might be hesitant to access care. And that's all we're trying to do. We're trying to reach as many people as we possibly can and create a little bit of a difference.
Rob DeClark, thank you very much for making the time to speak with me.
Thank you.
Rob DeClark is Executive Director of online addiction treatment provider Home-Based Recovery.
People First Radio, People First Media, and People First Stories are community media projects of Vancouver Island Mental Health Society and are produced in Nanaimo, British Columbia. The opinions expressed do not necessarily represent the views of Vancouver Island Mental Health Society or its broadcast, podcast, and social media partners.